Hi, I'm John Burton, Chair for the Department of Emergency Medicine at Carilion Clinic in Roanoke, Virginia. Many hospitals and emergency departments, when they're contemplating starting a bridge program from their emergency department for opioid use disorder services, they think that this is a very challenging thing. And while there are a number of key components to consider, the challenges really are not that difficult or the obstacles that high. First, a historic issue is that people often think that's just not what we do in emergency departments and hospitals treating opioid use disorder and opioid addiction. We need to break through that mindset. The numbers are staggering, and it's clear that there's a need in our communities to make a difference for these patients with opioid use disorder. Second, we often think this seems kind of complicated. The steps to get started are difficult. There's certifications to be done, there's new medications to prescribe, and things to consider. In reality, none of these are very high obstacles. There are a few things that have to be done, but none of it's complicated, and certainly not as complicated as what we do in emergency medicine and in our hospitals every single day. Finally, people will often say, we feel like we're going to open up the floodgates if we start one of these programs. By opening one of these programs, there's the concern that there will be more and more people that will come in with opioid addiction. There are already people in our community, as we know, lots of people in our community and in our emergency departments who are coming in who have suffered from opioid use disorder. Individuals with opioid addictions are common throughout our services, and facing the reality of that is something that creating a program like this really opens our eyes towards. By starting a program, we won't open the floodgates. We'll just recognize the problem and actually start managing and caring for the problem instead of looking the other way.